For patients with end-stage ankle arthritis, the surgical options are ankle fusion or ankle replacement. Both options are wonderful for pain relief, however, have different pros and cons. An ankle fusion is where we literally put screws across the ankle joint and eliminate any motion in that joint, and we heal bone across it as if it were a fracture. So you have no motion in the ankle joint. Patients are always worried that they're going to have a very stiff gait after an ankle fusion, and that's really not the case. Walking on flat paved surfaces with regular shoes on, no one would even be able to tell that you'd had an ankle fusion. It's only when you try to run or walk on uneven surfaces that they can tell that there's a little bit of stiffness in the gait, but you're able to ski, hike, etc. after an ankle fusion. The downside of the ankle fusion is that because you eliminate that ankle motion, the joints around it try to compensate and can become arthritic in the following 15 to 20 years after the fusion. Ankle replacement has the benefit of maintaining the ankle motion. However, just like hip and knee replacements, the metal and plastic wears out after a period of time. Because of the size of the talus or the central ankle bone, there's not enough bone stock for multiple revisions like there is in hips and knees. So we tend to be a little bit more conservative and recommend them more for older, lower demand patients who aren't going to need multiple revisions. The other somewhat downside of an ankle arthroplasty is the risk of infection. Infections in the ankle arthroplasty can be a devastating consequence, and so patients that have high risk like smokers and some diabetics are not good candidates for ankle arthroplasty. Ultimately, both are good surgeries for pain relief, and it just comes down to risk factors and activity level to decide which is best for you.